Hello, I'm Dr. Jim Del Rosso from Las Vegas, Nevada, getting into the fall spirit. And yes, happy Thanksgiving may be a little bit premature because that's in November. We're here getting into October with the leaves changing in many parts of the world. And it's even changing here in Las Vegas. The weather's getting a lot nicer. We don't have quite the sweltering heat that we have had throughout the summer. But I'm here to be thankful for the therapies, many new therapies coming. And we've recently had FDA approvals with three of the monoclonal antibodies that we would use in clinical practice. One we've had for a while, and two are new approvals. So the one that is new in terms of FDA approval, what we've had for a while is Bimekizumab under the brand name of Bimzelx, which has been approved for adults with moderate to severe plaque psoriasis that is a candidate for systemic therapy or phototherapy. And that's been very well established in terms of the benefits of that agent being an anti IL-17A and F inhibitor, as opposed to other agents that we have, the majority of them being 17A, one a receptor antagonist. So this has really been a big advance for psoriasis, but we now have FDA approval, though keep in mind the dosing is typically different. If the patient has only active psoriatic arthritis, then the dosing would be lower. If they have psoriatic arthritis and also the moderate to severe plaque psoriasis, you would use the psoriasis dosing, which is a little bit different and a higher dose per injection. And the sequence is a little bit different. But if they have active psoriatic arthritis and not the moderate to severe plaque psoriasis, the dose is lower. And for these new three indications, which I'm going to mention, it's always every 4 weeks, the 160 milligram injection every 4 weeks. And that's active psoriatic arthritis, active ankylosing spondylitis, and active non-radiographic ankylosing spondyloarthritis. And those are three entities that are somewhat cousins of one another, especially the last two, that we can be in a position as dermatologists to actually, based on symptoms that we might hear from the patient, can be the ones to make that diagnosis in patients that we might be seeing for psoriasis or otherwise, and get the patient the care that they need. So bimekizumab is now approved for all three of those new indications in adults, in addition to already being approved for the psoriasis indication that I mentioned. But now we have two agents that have not been previously available that are new to us as far as being available that we can use now in practice. And one is Nemolizumab, which is an IL-31 receptor antagonist under the brand name of Nemluvio. And this is an injectable monoclonal antibody that is FDA approved for adults with prurigo nodularis. The indication line does not specify the severity of disease, but certainly if we look at the clinical practice, these are patients that had at least 20 nodules, and a third of them had over 100 nodules of prurigo nodularis. Very favorable efficacy, showing major differences versus the placebo arm within the first 16 weeks, and then continuing on, seeing improvement continuing, increasing, and sustaining going out in the long-term efficacy study. Tremendous effect against itch. It's been labeled the itch cytokine. I'm not exaggerating that, but it has other functions. It actually will help the skin barrier. It reduces the fibrosis and the skin thickening and reduces pathways of inflammation that are involved in prurigo nodularis and also known to be associated in other diseases. But prurigo nodularis in adults is the current new FDA approved indication. Very excited to see that this is available to our patients, and I know many other clinicians are. The third is Lebrikizumab, which is under the brand name of Ebglyss, and this is an IL-13 antagonist. And we already have one IL-13 antagonist on the market, tralokinumab, which is under the brand name of Adbury. This is Lebrikizumab under the brand name of Ebglyss. They're both anti-IL-13 agents, but each of these agents has some of their own specific differences that relate to the molecule binding and other pharmacologic characteristics. So, yes, they are both approved for moderate to severe atopic dermatitis in adolescents and adults, meaning 12 years of age and older, that have not been well controlled with topical therapies, or those topical therapies are not advisable. And they may have used other treatments, but now they need more. So lebrikizumab is FDA approved in this group, and they do state the patient needs to be 40 kilograms or 88 pounds or older. Look at the dosing, because you can modulate the dosing based on the response of the patient, that they can extend out to every 4 weeks instead of injection every 2 weeks. And there are several other distinct advantages looking at both the upfront therapy and the long-term treatment, which we now have, including when patients reach a success and they went to the placebo arm, there was sustained benefit over a considerable period of time. They looked out to a year, even for those patients that were not actively getting the treatment. A lot of data on it, as there are with all of these drugs, but it's important to know that it's available, and it's something that I'm always welcome to look at new therapies, because there are patients that respond to one and not another, or have a problem to one with one, then we can use the other, even if we're in the same therapeutic class. So that is the third of the three. Things tend to come in threes, and but I'm looking forward to more, and I know we're going to get more approvals. I hope that helps you at least touch some of the high points, but look at all of these drugs of further, all of these products further, and learn the nuances, because a lot of your patients are going to be helped.